Good morning. It is January 16th. There has been a lot of twists and turns in both the state legislature and Congress this week, and so we are going to get into it all. For those of you who are attending from another state, skip through Wisconsin unless you want to know what's going on here. And we will get to Congress and what the administration is doing and some other impacts of the reconciliation bill that are hitting states after this. So, Wisconsin state legislative session is kind of in not quite its final moments, but moving towards them. And this week we learned that the state assembly is rumored to be doing 8 total floor sessions, before the end of the session, and that they would like to be done by the end of February. For those of you tracking time, it is now solidly the middle of January. So the end of February is about 6 weeks away. And this week we had 2 floor sessions, and there's another floor session next Tuesday. So for those of you doing advanced math, 8 minus 3 is 5. And that is important because it means whatever bills the Assembly has passed end up being the bills that the Senate can just agree to. There's a fancy word called concur. And then those bills have an easier time passing both houses of the legislature and being advanced to the governor's desk where they could either be signed or vetoed. And once the assembly has ended its session and said, hey, we're done, we want to go out and campaign, it can happen that they come back into session to do business, but that isn't necessarily a path to rely on, for example. So really what happens in the next 6 weeks in the assembly and is going to determine what is the list of things that will or won't happen in the session. And the Senate is rumored to only be coming in once in March. So that means they're kind of waiting for the assembly to do whatever they're going to do, and then have one day, kind of a cleanup day, where they decide what bills have passed the assembly and that they will also agree with. The Joint Finance Committee in our legislature is a kind of special committee. It's made up of both Senate and Assembly members, and they do have the ability to meet throughout the year. The Joint Finance Committee is sometimes referred to as Wisconsin's budget writing committee. So their main work is on the state biennial budget, which you may remember was signed into law on July 4th, the same day as, or actually July 3rd, just before the federal HR 1 bill was. But Joint Finance has the ability to meet throughout the year because oftentimes they have a say on any piece of legislation that has that costs money. So they will meet and look at pieces of legislation that have been proposed that aren't law yet, that cost something to do, and they need to approve that amount of money to be spent because those bills that have a fiscal impact weren't accounted for in the current budget. So joint finance, when it does the budget, sets aside a certain amount of money, figuring that there might be things that the legislature wants to do that are new and aren't factored into the current budget. They also have the ability, state agencies sometimes don't end up having enough money to do the things that they are supposed to do. DVR is a good example for this. There was a set amount of funding to run that program, and there was more demand than they had money. So that is an example of a state agency that has a budget for a certain program, and the amount of money set aside was not enough to actually run the program in full. So state agencies and the university system and other, places that receive state money sometimes come back to joint finance and using a statutory authority called a 1310. It refers to the section of the statutes to say, hey, we need this amount more to be able to do what we said we could do in the budget. So for those reasons, Joint Finance 16-member committee is one of the few committees that can meet outside of regular session. They've been meeting about once a month, and conventional wisdom would say that they just met this week. So they met, I think, yesterday on Thursday. Um, so conventional wisdom would say that in an election year, even though joint finance can meet outside of regular session, they typically will not meet outside of regular session unless there's a true emergency. Because when you have 16 members that have to all get into Madison together, it's hard to do that on a cycle. So really for all of the things that either need additional money or may need some legislative action, the time is really now because the likelihood of the legislature acting before next January is pretty low if it doesn't happen within the next 6 weeks. So another thing that is now true, Wisconsin Eye, which is kind of Wisconsin's version of C-SPAN, has been an invaluable part of how people know what their legislators think, and they can watch committees and watch the floor session and hear what people say and know what bills are being talked about. But Wisconsin Eye does not have enough funding right now, and it has gone dark. So in this particular moment, when we have many, many bills that are being debated and a lot of pressing needs that may or may not get done in the next 6 weeks, Wisconsin Eye isn't there to film it. And they have also taken down all of their archive footage from the last 18 years. So that's been an especially important resource for people with disabilities, families, and caregivers, because a lot of people can't get down to the Capitol to sit through an 8-hour hearing, for example. It's hard to know what's happening when, there aren't multiple ways to figure out, what the schedule is. And a lot of us are finding that it is much more difficult to know what is happening in the legislature and how people feel about it now that this service is not watching for us. Here's what hasn't happened yet. The special education bill that we've been talking about the last several months, this is the bill that would kind of make good on the promise the legislature made in its state budget to fund special education at a reimbursement rate of 42 cents on the dollar. You might remember that the amount of money they set aside wasn't enough to meet that reimbursement rate. So this bill kind of asks the legislature to come up with the $140 million gap that is missing to cover the actual costs of what 42% of the costs are. And it had a long co-sponsorship period that ended last Friday. Generally, when a bill closes for co-sponsorship, it takes a little bit of time to assign the bill a number, and then the bill gets referred to committee. So in the next few days, usually it takes up to 10 days to get a bill assigned a number. Sometimes it's faster, sometimes it can be slowed down, depending on, how urgent the majority thinks it is. But when that bill is introduced, you will be able to see which legislators put their name on the bill, which indicates support, and who's missing. And also, when the bill is referred to committee, there are some action steps that advocates can say to ask for the hearing on that bill. Food share, another piece that is outstanding. Remember, we need additional money to be able to meet the federal requirements that are part of HR 1 and make sure that we are keeping, we have enough people in the counties to administer the food share program and also keep our error rates low. there is no movement that advocates could see on moving forward extra money needed to comply with those federal requirements, which means that if that doesn't happen, we have all of the implementation that has to happen, but no extra people and no extra administrative money to make sure it's done well and in a timely manner. In October 1st, another provision of HR 1 kicks in, which actually reduces the amount of money the state gets from the federal government to implement the SNAP program. So beginning in October, the state will have to put in more of its own money to administer that program. And without, action now, we won't have that additional money to do that. DVR, we kind of just talked about. That's another place. The agency has not yet submitted its 1310 to the Joint Finance Committee. Certainly advocates have said that the time to do that is now before the session ends, because it is more likely that Joint Finance would be meeting, in February and March. And after that, it is really not guaranteed. There are some movements on some bills that we've been following, amendments that are introduced. A lot of those, the amendments are not necessarily responding to advocate concerns. So again, we're now in a place where some of the bills that people may have been watching and had concerns about may move forward, but they may not be better than they were before, even if they are amended. So let's take an assessment of what are our potential state budget gaps, because we're already starting to think about the next budget cycle. I know I just said we had 6 weeks left in this regular session, maybe longer, but the reality is that once this legislative session ends, we have a campaign season, elections, primaries in August, and the general election in November. And then remember, we have a new governor, and we have potentially new senators, state senators, and new assembly people. And those folks aren't seated until next January. And we don't start the next state budget process really until next February in earnest. So for the things that are shortfalls now, think about it as every one of these items that doesn't get addressed now becomes kind of where the budget starts in the red next time. So we have a $70 million upper that may or may not get approved. We know we have a $140 million shortfall in what was promised for special ed this year, an $11 million shortfall for DVR, and the Medicaid budget is $213 million behind. That's what we knew last week. That's roughly $500 million. That is money that does not, that's $500 million where what we have promised to do right now in the current budget, we're $500 million behind. We did not budget enough money to do all of the things that the state said it was going to do. Okay? Now, the Medicaid deficit or the Medicaid projection can go up and down, right? Depending on how many people are using Medicaid and what they're using it for, and drug prices and all sorts of things. So that number is an estimate, and it can fluctuate up and down. Mostly it fluctuates up. It has been my experience in the past. This week, our friends at the Legislative Fiscal Bureau are also releasing important reports that Joint Finance takes into account and thinks about and puts in the back of their mind. The Legislative Fiscal Bureau is they're kind of the budget hawks of the state, and they work for the legislature to help them understand how much should we estimate things will cost? What are your options to change things or fund things differently? And they play a huge role in the state budget, but also a big role in assessing bills and do other important work. And this week they released two things. First of all, they released a paper on um, a number of different programs that are funded with different kinds of fees. And apparently, there are 22 appropriations that are supposed to be funded at a certain level by fee revenue, and the revenue that they need isn't coming in. So when you total up all of the programs that are funded by fees and look at did they get enough fees to cover the cost of the programs, they're $218 million short. The Department of Administration has to put together a plan to figure out how to fund those things. But still, it's an important signal that says, hey, the way that you are funding certain programs is consistently not getting them the amount of money that they need to run. And that's something that Joint Finance will pay attention to. Yesterday afternoon, the Fiscal Bureau released another important document talking about revenue projections. And revenue projections kind of estimate how much will be collected in taxes. This is kind of a mixed bag paper because the Fiscal Bureau said, well, we expect to collect more revenue in taxes than we were assuming, $1.5 billion more. But it also had a discussion of the $213 million shortfall in Medicaid and also a section on some uncertainty with how CMS may interpret Wisconsin's inclusion of raising a certain kind of tax that funds hospitals. And the paper said, well, depending on CMS's interpretation, that could mean if they don't allow the state to do what it thinks it can do, then that could mean a $792 million shortfall in the current budget for Medicaid. Now, a lot of folks kind of think that CMS may be not interpreting this correctly. And this interpretation hasn't come out yet. It might be part of a federal rule proposal. There are lots of opportunities to comment on a federal rule, and nothing has happened yet. But the Fiscal Bureau is noting this uncertainty because it's a pretty big deal. If the CMS interprets things in a way that cause this level of shortfall, it is not something that the Joint Finance Committee could ignore. Even if the state is in the right, even if the state challenges CMS's interpretation in the courts and wins, all of that takes time. So it's an important thing that finance members will now add to the list of things they're thinking about for the next budget cycle. We're getting a little more clarity about the impact of the expiring subsidies have had on Wisconsin. And of course, there's still the unknown unknowns of what will the federal government change, and specifically this administration when it comes to money coming to states. I don't have a slide on this in this particular presentation, but some of you who are watching really closely might have seen that within 24 hours, $2 billion of SAMHSA grants were canceled and then magically restored by the Federal Department of Health and Human Services. So, this is the kind of thing where decisions that money that has been budgeted and allocated being turned off and turned on is something that is happening, and that is not something that states can really plan on. So how about that Affordable Care Act? Wisconsin, again, this is as of January 3rd. The open enrollment period for most states ended yesterday, January 15th. There are some states that have extended their open enrollment a little longer. There's one state, I think it's Idaho, that ended its open enrollment period December 15th. But for the majority of the states, open enrollment for the Affordable Care Act is now closed. And we are starting to get at least an initial snapshot of how many people have dropped their ACA coverage, probably due to the increased costs to them because they don't have a subsidy that is covering enough of their premium. So in Wisconsin, 17,000 people dropped their ACA plan. And nationwide, that trend is continuing as well. Remember, CMS does the enrollment for about half of the states. There are some states that have their own state-run enrollment program, but what CMS is reporting is that there's at least 1.5 million people who were in the marketplace last year who aren't now. And 17,000 of them live in Wisconsin. This is not unexpected. Insurance companies expected that higher prices were going to, one, drive people out of the marketplace and also leave the people in the marketplace with the more serious health conditions, which could raise costs for insuring, who's left in the marketplace more. We don't think that this is the end of the story. We think this is the first snapshot because many healthcare policy experts believe that, even if people have enrolled in a plan, if they can't afford it and they don't pay that first premium bill, they are then out of the market. So we can expect that we will see at least a couple of updates on this, right? As of January 3rd, well, that's a couple weeks ago. So there'll be another snapshot of who enrolled as of yesterday and another snapshot of who didn't pay their first premium and has lost coverage. And if you want a nice article, Kaiser Health Foundation did one. There are lots and lots of people who are very low income who had plans that maybe didn't cost anything because the amount of a subsidy that they got was enough to cover all of the premiums for the plan. They're called zero premium plans. Wisconsin has a lot of those people because we did not, as a state, when we were one of 10 states that did not expand Medicaid. So we have many, many lower income people in our ACA marketplace. In states that expanded Medicaid to increase the amount of the income people can have and qualify, they have a lot of the people that are in our marketplace covered under Medicaid. So for states like ours, we have a lot more people who are likely in this situation where they had a $0 per month plan last year and the subsidies expired and it's not $0 anymore. And I think this particular article is really good about illustrating that you don't have to have the plan be super expensive from a, kind of middle class perspective to have it be unaffordable. Looking at the lowest coverage plan, this person discovered that the cheapest plan he could find that still guaranteed ACA coverage, bronze plan, was $70 a month. That doesn't seem super expensive until you don't have $70 a month. And I think that that's where many, many people are, who are kind of in this position of, am I going uninsured or can I actually afford a plan? It doesn't matter how cheap the plan is if it's more than you can afford to pay. I'm going to skip these slides. We went over those yesterday. Still time to sign up for survivals organizing trainings if you haven't already. Moving down onto Congress. So here we are. There's been a lot of activity and non-activity. I feel like we say that every week. But this week, there has been some movement on 3 of the 12 appropriation bills that Congress needs to pass. We have also seen the bipartisan Affordable Care Act extension package in the Senate stall. Last week, I told you they said they wanted the legislative text to come out on Tuesday. It didn't come out on Tuesday. or Wednesday. And by yesterday, they said they were not going to introduce it until the Senate gets back. Here's where things get interesting. The Senate is not in next week. Okay. We're expecting that they may release the legislative text for 3 more appropriation bills this weekend, but the Senate is not scheduled to be in next week, which means that they aren't going to be doing any business. And that means that when they come back January 26th, they will have essentially 5 days to get a long list of work done. The House is in session next week. Again, they are hoping to release text on 3 appropriation bills this weekend as well, and pass those bills next week, which is still a hard thing to do. And then the House is scheduled to be out the last week of January, just when the Senate is coming in. So, January has looked like it has a lot of time. It looks like it has 30 days in it, right? But when Congress is only working, only has 15 session days, all of a sudden your time is cut in half. And now we really are in the place where the Senate only has 5 working days and the House only has 5 working days to get all of this stuff done. Where are we in the budget process? 12 appropriation bills. 3 have already been signed into law. And the House and Senate passed 3 more this week. So we're up to 6 done. That's 50%. That seems exciting. We're not grading Congress because 50% would still be a fail, but it's better than 0. The House was supposed to pass 2 more appropriation bills this week. These are kind of considered not controversial bills. And it is moving those forward. The Senate is out next week, which means it can't vote on the bills the House passed this week. And the House is out next week, is in next week and out the week of January 26th. So either between January 26th and 30, the House and the Senate agree to the 4 remaining appropriation bills. We're assuming that they will pass the 2 non-confrontational bills, or they will have to figure out some version of a continuing resolution. And it does look like that the bills that are of most importance to people with disabilities, the labor HHS and education bill, there's still negotiations happening on those. And the HUD transportation bill are on the list of things that are moving. The Department of Homeland Security funding bill is not moving right now. There's a lot of disagreement there. So it is likely that Congress may not to be able to get to agreement on some issues, and they do not have a clear plan at this point on what to do about that. Nobody seems to want another continuing resolution, and nobody wants to shut the government down. But they're also not agreeing on some key issues. Another challenge Congress has, and this is now going to be a kind of constant challenge, is the Republican majority in the House is smaller than it was. They had a member die. They had another member have a pretty serious accident. A 3rd member resigned in December. And we had a 4th member who has a family medical emergency. So there really is only 1 vote to spare now if Republicans want to pass things with only Republican votes. And that has been the pattern over the last several sessions. Yes, some of us remember when Congress used to pass many bills that needed both Republican and Democratic votes, but we have seen over the last probably 15 years that there have been many fewer bills that include members of both parties when they're passing it. This week, that means a couple of things. First of all, it gives power to members within the Republican Party. And remember, there's kind of 5 different factions in the Republican Party in Congress. It gives a lot of leverage to small groups or individual members to really push for changes to bills, right? And that can be, important if a member says, no, I don't want that language in, or I do want this language in, and if it's not there, I won't vote. That now that you can only afford to lose one vote, that really could mean the difference between the bill having enough votes to pass or not. If again, you're not willing to have Democrats vote and support and write a bill that Democrats support too. And what we've seen this week is that the faction of the more fiscally conservative House Republicans has successfully leveraged and pressured for changes to bills in exchange for their vote. And in some cases, they have voiced enough opposition that planned votes on bills have been canceled because there isn't enough support to pass them with only Republican votes. The other impact of this narrow majority is whenever Congress leaves to focus on campaigning, it is going to be much harder to get them back to Washington to take votes once campaign season ramps up. And that is important for a couple of reasons. One, it may impact whether or not Congress does or doesn't pursue more legislation. Two, it also means Congress may or may not provide as much oversight of the administrative branch as it normally could, because it's just too hard to get members all in the same space. And in this particular administration, we've certainly seen that there has been a pattern of kind of acting it as an administration alone without consent or consulting with Congress, and sometimes in opposition to the direction Congress has given. So, notably, the Department of Homeland Security bill is not moving. It was supposed to be included in the list of bills that were being considered this week, but there has been tremendous concerns raised about how ICE is conducting itself, where there are a lot of, especially Democratic members, who are pushing for language changes. And some of the Senate seems to be willing to do some of those language changes. But again, the House and the Senate have to agree on the exact same language. So what the Senate feels is okay may not be what the House feels is okay. And there are even some folks that are calling for another shutdown specifically over funding for the Department of Homeland Security. We'll see how this plays out in the next couple of weeks. It's certainly possible for Congress to pass other appropriation bills that get signed into law and then have one agency where there isn't agreement yet, whether they pass a continuing resolution, whether this particular bill trips up and interferes and delays other appropriation bills, that's a possibility, or we could end up in a shutdown. It's unclear at this point, but there is a lot of disagreement. Two key things. Among the bills that were passed this week on appropriations, the Commerce, Justice, Science bill is not one that we typically follow. Science funding and research funding is actually housed within several of the 12 appropriation bills, and the Commerce, Justice, Science bill is one of them. There's also science research in water, energy, and interior environment, and the labor HHS education bill, among others. And people are highlighting that much of this funding for science research that the White House wanted to cut, Congress actually restored in this appropriation bill. So there's definitely an intent Congress has to undo some of the cuts that we saw implemented last year, and give very clear direction that nope, we want these things funded. The major sticking point in the labor HHS education bill is education. There's some reporting this week that, and we'll cover some of this later, that the U.S. Department of Education is in fact pursuing its plans to um, outsource or give certain functions of its department to other federal agencies through memorandum of agreement and kind of skirt around Congress, Congress's authority, statutory authority that it set. So when it comes to the appropriation bill, there are some folks who want to say, hey, we don't want the Department of Education to simply contract out the work it does with other federal agencies, and we want to put in specific language to stop that from happening. And that is in keeping with, what the House and the Senate passed, or the committee work, that assumed that the Department of Education, one, existed, and that all of the programs that are currently funded under that agency exist. And the committees decided that they would like to keep funding those programs at the same level. So the real issue is over whether or not the department has the ability to deconstruct itself without Congress doing anything. There's not agreement, again, between the House and the Senate on this. There are some House members that really support the elimination of the Department of Education and would see any language that is added to prevent that as being a non-starter or not making the bill not able to pass in the House. At this point, there's been at least 7 interagency agreements to transfer parts of the Department of Education elsewhere. And there are certainly rumors that are being reported of plans to transfer more programs, including special education and rights enforcement. So we have the administration that is kind of moving forward a plan that Congress never agreed to, at the same time that Congress is trying to figure out how do we fund these programs. And some people want to prevent the movement and the dismantling of education, and other people seem to be fine with leaving the statutes as they are and not having a Department of Ed and just letting the programs be dispersed and funded and administered by other programs. So the question seems familiar. It's because they're really important at this point. Congress is going through a lot of effort to pass a permanent funding bill. And that's important because we saw in 2025 that when they passed a year-long continuing resolution, the administration did not see that as something that they had to follow. There was lots of either cancellation of funds or freezing of funds or moving of funds or rescission of funds that had been approved to be spent. So there is a theory that if you pass a permanent budget and that permanent budget is signed into law, it really is more directive to the administration that you got to do these things. However, it is unclear whether the administration will continue the pattern we saw last year or will change its ways. And it's important for, citizens to keep watching what is happening to the actual money that Congress says should go to different programs. Like I said, this week we had $2 billion of SAMHSA grants canceled and then restored within about 12 hours because people were watching and they objected and Congress heard about it. And those happen to be programs that a lot of members of Congress feel strongly about. So it's kind of a reminder that constant vigilance is really necessary. Turning to the Affordable Care Act. In December, Congress said, we don't need to worry about the expiring subsidies in December because we can retroactively fix the subsidies in January. We can pass legislation in January and it'll be okay. There were lots of reasons we discussed about how that wasn't really the case. And certainly some national watchers thought it very unlikely that Congress actually would pass anything on the ACA subsidies at all. So this week we've had some movement. There is a bipartisan group of senators who's coming up with an alternative plan on the Affordable Care Act. It's different than what the House passed. It is not a straight extension of what the subsidies were before. That does mean that it would take states, if it did pass, it would take states more time and be harder for consumers to understand the new options and what they need to do. We were supposed to see the legislative text this week. Now the Senate group said it won't release the bill language until the end of January. And most people seen that as a really bad sign because it means that there are big pieces of that bill that lawmakers just don't agree with. And it may be more than one area. So if they didn't release the text this week, that means they've again got 5 working days before the end of January to introduce the text and then move it all the way through the process. That looks pretty unlikely that anything would pass by the end of the month. And many people think that even if it is introduced, it may, the longer they wait, the less it matters whether it passes at all because the damage is already done. Plus, what the Senate Republicans agree to may or may not be appealing to the House. The president has done a couple of things this week. There's an article about him vetoing any extension of the health subsidies, and the White House has introduced its own health plan, and the fiscal conservatives in the House have introduced other ideas that include health care, which we'll talk about next. So what's in the Senate bill that seems to be moving towards doom? It's worth knowing what the ideas are because some of them will be familiar. First, it sets an income cap on, again, this determines how much can you earn before you don't get a subsidy, okay? That's a familiar thing. That was true of the last subsidies as well. The concept of health savings accounts is coming up again. Unlike the bill that Senator Cassidy proposed in December, which would have required the amount of money that you would have gotten in a subsidy to be put into a health savings account. This bill makes it optional. So that's a slight difference, but the fact that this is the second time we're hearing about money that's supposed to go to help people pay their premiums instead being redirected into a health savings account, which has very different rules at this point, is important. And then the third piece is getting rid of zero premium plans like that person in the earlier article had. So in other words, there would be a minimum premium that would be required for every plan. We're not going to spend a ton of time on this, but the income cap is more generous than the previous subsidies were. However, the costs are also higher. So again, if you say people who earn more than 700% of the federal poverty line, it sounds generous, but 700% of the poverty line is about $110,000 per year for a single person. Lots of people don't earn that amount, right? But lots of people do who would consider themselves pretty middle class. That's higher than 400%. 400% of the federal poverty level, $63,000 per person. So there would be more people who would have some amount of subsidy coming in, but for some of the folks, especially older adults, who are facing the biggest premium increases or are living in areas where there are very few plan options, and people who have rather high health costs or conditions that demand a lot of health care, there are going to be people who are going to be in the same boat that they are in now. In other words, the plans that they need, provide the care they need, are going to be unaffordable. And there might not be subsidy help for that. The health savings account provision Again, it is optional versus mandatory under this bill, which is a significant difference. But as a reminder, health savings account under current federal law, you can't use the money in those accounts to help you pay for premiums. So for folks who where the monthly premium cost is really the thing that is going to keep them from having health care or not, or having a plan that covers more or doesn't cover as much. A health savings account is not the same, and it's not giving the same kind of help. And that may mean it's less valuable for some people. It's optional under this bill on where you want your money to go. But again, it's another choice for consumers who have to understand those options, understand their choices, and make the right choice. Right, meaning the one that, they're taking a bet that it will be a better use of those funds to put in a health savings account rather than have a lower premium per month. This one is important, and we'll spend a little time on it because um, this is a strategy of requiring a small amount of money. You sometimes hear members of Congress say, well, people have to have a skin in the game. If you give somebody something for free, they don't value it. And so if we put a small fee in that, that helps people feel like they've bought into the system and have some responsibility for it. The challenge is that even though $5 per month premium seems like it's not a lot of money, this actually has a big impact on low-income people. And the reason why these zero premium plans exist under current law is specifically to address how many people have a hard time consistently paying small amounts of money and the impact that paying small amounts of money has on people being able to keep their care. About half of the people, again, more people in Wisconsin, have low enough incomes that they qualify for a zero premium plan. These are people who earn less than 150% of the federal poverty level. And we have a lot more of those people in this state, again, because we didn't expand Medicaid. For people who are low income, it can be really hard to pay monthly premiums if your job is unstable, if you don't have a bank account, and about this pretty high number of people who don't have a bank account, and if you don't have a credit card. It also gets harder when people move a lot, like if you're changing housing and other things and maybe doing that several times a year, where missing that premium bill, if it shows up at the wrong place, you might not get it. And of course, you have to pay it by a certain time, otherwise you lose your health care coverage. So there are lots of low-income people who have pretty significant structural barriers to being able to move money around easily, and especially small amounts. And if they miss a payment, they lose their health care coverage because we don't allow people, you can only enroll in plans at a certain time of year. So these low premium plans seem like they're a logical thing, except in practical reality, what they mean is there are an awful lot of people who lose their health care coverage entirely because they miss a $5 a month premium. So the president last night at about 8 o'clock released a healthcare framework. It's hard to call it a plan because you are seeing the entire plan. It is a one-page document. Actually, that's not true. It's 2 pages, but one page is a cover page. So what you see on your screen here is the entire thing that was released. And some folks are looking at that as, being different than what Congress is considering, and in some ways undermining the negotiations that are happening in the Senate. Some of the ideas in this plan are familiar because they've been tried before. Not all of these are bad ideas, um, but some of them will have far less impact on costs than people think. And are these ideas actually addressing the root reasons why healthcare costs are higher? I don't, a lot of experts would say, well, these are things you can do, but it really isn't going to, address what is causing healthcare costs to go higher. So lower prescription drug prices. This has been something that both parties have talked about for a lot of years. Um, it isn't a bad idea in the sense that prescription drugs are a high cost and they are specifically a cost driver for Medicaid, right? Prescription drugs are also an optional service in Medicaid. So lowering prescription drug prices is not a bad idea in terms of that is a major cost driver in this for healthcare. And if you paid less for it, it would, lessen the amount you pay for healthcare. But it also isn't the only cost that's going up. All of the costs are going up. Again, we're seeing the idea repeated that we're going to switch, the money that was being paid for subsidies, we're going to have people put into health savings account. So this is now the third time that idea is being repeated, right? We have a standalone bill that failed, Senator Cassidy's bill. This is part of the ACA bipartisan negotiation, and now it's appearing here. No information about whether that is optional or mandatory, but again, health savings accounts can only be spent for certain things, and unless the federal law has changed, premiums, you can't use that money to help pay for your premiums. The third idea here is again, requiring more price transparency from insurance companies, hospitals, and physicians. That's not a bad idea. Lots of state legislatures, including Wisconsin's, have wrestled with various kinds of bills and ways to do that. However, knowing what the prices are doesn't really help the consumer when they have no choice, when they don't have authentic choices. And there's been actually quite a bit of research on this where, just knowing what the prices are doesn't help you if you, in fact, don't have different places to go. Many areas are dealing with maybe one or two health plans, or maybe there's only one hospital in the area. And an awful lot of healthcare costs are actually things where there isn't an ability, most healthcare costs, there really isn't an ability for consumers to shop around for the best price. So in terms of, does it help drive healthcare costs down if you can show people what the prices are and then they don't have any options anyway, or the prices are for things that there isn't really any ability to negotiate. Meanwhile, House Republicans are releasing another plan. And this one is in context of thinking about healthcare as being part of another reconciliation bill. H.R. 1 was a reconciliation bill. Reconciliation is a special process that it has to be focused on budget issues. And the reason why it's popular and used for quite a few pieces of legislation is it requires a simple majority in the Senate instead of a 2/3 majority. And what that translates into is you can pass a bill with 50 senators and the vice president voting for the bill, voting yes on the bill, instead of 60 senators voting yes. And in a Senate that has a lot of disagreements, having to only have 51 people agree to something instead of 60 can make all the difference in the world between something passing or not. H.R. 1 was a reconciliation bill, and it passed with only Republican votes in the House and only Republican votes plus the vice in the Senate. So this is a strategy to be able to move legislation forward just by all members of one party agreeing. If every member in the majority party, which is Republicans in the House and the Senate, agrees to a reconciliation bill, then it can pass without any help from the Democrats. And So it's unclear whether or not, especially with a much narrower majority in the House, there's really interest in moving forward another reconciliation bill this year. You can do a reconciliation bill once each fiscal year. So this would be the one for 2026. Um, Unclear if this will happen, but it's worth knowing what ideas are being considered as part of as being worthy of trying to move another reconciliation bill. And I'll point out that eliminating broad-based categorical eligibility for the welfare system is a pretty big idea. Welfare system doesn't tell you exactly what programs they're putting in that category, but Medicaid would be one. And that certainly is an idea that was in Project 2025, is to not automatically decide that certain groups of people are eligible because they belong to that group. Presumptive broad-based categorical eligibility, for example, includes people over a certain age and people with disabilities, elderly, blind, and disabled. Those are examples of people who might be eligible because of their belonging in that group. Also, another return to the ideas of reducing the amount of federal Medicaid funding going to states if they don't adhere to certain federal policies, and some other things that are now quite familiar to us. Again, changing ACA subsidies for premiums into health savings accounts. Fourth time that idea is appearing. And also other ideas about let's have other insurance options that don't require the same coverage as the ACA be out there. That's, again, another idea that keeps being repeated. Once you see ideas being repeated 2 and 3 times, you kind of have to start paying attention to them. So the administration, moving to them, in the last probably 10 days, we've really seen the idea of fraud being used as a reason to freeze or cut federal funding to states for various kinds of programs. And there was a couple articles out this week that are pointing out that the idea that fraud is present means that the programs that is a reason enough to either cut funding or stop payments to programs, has really big impacts, not only on states and their budgets, but also the people who rely on those programs pretty instantly. So this is a strategy that we are now seeing, and we can expect might continue. Most recently, the administration immediately froze certain kinds of childcare funding. A judge has temporarily said, no, you can't do that. You can't just stop $10 billion of federal funding for certain programs in 5 states that all happen to be led by Democratic governors. The programs that were being frozen include some that will be familiar to some folks on this call, Temporary Assistance for Needy Families, or TANF, as it's commonly referred to, Child Care Development Fund, and the Social Services Block Grant. So temporarily, while the case is ongoing, the administration has been told, no, you can't just freeze these funds for these states. But important to also remember, all of the states now have a new requirement to check attendance at child care centers and are now being kind of told you have to defend the spend. That's the phrase that's used, that you have to really make a case for all of the funding that you are being reimbursed for in advance of the reimbursement. So what that means is, again, a lot more work for the providers providing the service to have to kind of get the right paperwork in order to justify the expenditures that they have as a child care agency before they can get the money for the work that they've already done. And again, there's a theme here. When you require more administrative work, you end up creating conditions for more mistakes to happen, which can cause delays, and you create an administrative burden that is so high, it can take away from the actual work and or mean that people have delays in reimbursement or don't get reimbursements because of paperwork, delays and problems and other things. In this case with childcare, it really does kind of slow down and stop the flow of money. And there are lots of childcare agencies, much like personal care and home health agencies, that are really running on shoestring budgets, and they are dependent on funding coming in, reimbursements being done on a timely manner. And like personal care and home health agencies, a lot of the child care programs, yes, they have some number of people who are receiving federal subsidies, but they're serving the wider community and they serve families of all income levels. So when you have funding delays that kind of impact the overall bottom line or operational budget of these small businesses, it could jeopardize the whole business. And we've certainly seen in home health world where there are some agencies that have either stopped serving, they've gone more to private pay as opposed to serving Medicaid patients, or they have closed altogether because they just can't make it. And those are certainly things that are happening in the childcare industry too, as tight money and delays in funding end up impacting, a business that often requires pretty high, constant costs if you're maintaining a building and staffing and other things. Another lawsuit that has come to a new step in the process, again, after the vaccine committee made some changes, the American Academy of Pediatrics had some strong responses to those changes. They did not agree with those changes. And what happened is that the administration decided that it was going to cancel 12 million in grants to this group that had conveyed concerns about the changes to the vaccine schedule. They terminated these grants in December, and they had a wide variety of things that those grants were helping fund. So again, another federal judge has ordered the administration to restore the funding temporarily while this lawsuit is ongoing. And interestingly, the judge's opinion ruled in favor of the American Academy of Pediatrics because they thought that it was highly likely, and there was evidence that the cancellation of the grants was a retaliatory move by the federal agency. We talked a little bit about CMS no longer requiring states to report vaccination status for Medicaid and CHIP kids as a measure of quality. KFF did a much deeper dive this week, if that's something of interest to you. It is important in the sense that it will be harder to measure where there are places where there may be fewer people who are vaccinated for certain diseases like measles. And so this article really goes into what is the impact of not having, of states, some states may be deciding that they're not going to report these at all. Oops. KFF also did a deeper dive onto what are the changes to the childhood vaccination schedule and what does it actually mean. Most insurers are required to cover vaccines at no cost when they are recommended by the CDC and certain subcommittees that are, supposed to be making vaccine recommendations. But there is so many childhood vaccinations will continue to be covered because they're still recommended at some level. However, there's one vaccine where that may not be the case. And this article kind of goes into, all right, what does it mean as vaccination schedules change in reality? And this is the first example where, there were 3 doses of this vaccine that were recommended. Now the recommendation has gone down to 1 dose. The science hasn't really changed, but it is clear that insurers have to cover 1 dose, and it is unclear whether they will cover the other 2 doses that perhaps a pediatrician might recommend, and what is the financial cost to the individual if they really want to make sure that they're following the old vaccination protocol that was just changed. A lot of watchers are saying that they feel like there may be some additional changes to vaccine recommendations. So this is kind of an issue to keep watching. The insurers have seen the value of vaccines because often it is much cheaper to vaccinate and have either a person never get a disease or get a much milder case of it than it is to treat the disease itself. But this is, again, uncharted territory. For most of our time, we have been recommending additional vaccines to cut down on the expression of disease. And this is the first time where we are recommending fewer vaccines. So it's hard to know, what the future changes might be and what insurance companies' response could be. And to give you a preview, here are some of the things that, watchers are thinking could be among the, additional changes to vaccine policy. Keep in mind that these changes were not made through the normal committee process at CDC. They were made by the agency itself, and that the membership of those vaccine advisory committees has been being changed by the administration. And there are a number of new appointees who are very skeptical of vaccines that are ending up on the committees that are governing what vaccines are recommended. So the Education Department, national advocates have met with the U.S. Department of Education Secretary and have been told that she intends to continue moving parts of the agency elsewhere, including the Office of Special Education Programs. It seems like what advocates are being told is that the whole Office of Special Ed will move as one unit. So that was unknown before. But it's not clear where it will be moved yet. There's no agreement that's been signed. Nothing has happened yet. It's very unclear where Rehabilitation Services Administration will be moved. It may not be the same place as special ed. So that's unknown at this point. There are some signals that where special ed gets moved might be under the Administration of Community Living in the Health and Human Services. And that's based on a couple of people that have recently been hired. So there's nothing known yet, but there are some signs in the wind that certainly the plan to eliminate the Department of Ed is still in motion, and they're still deciding where special things that are important to students with disabilities are going to go. So stay tuned. Moving to the continued impact of HR 1. Remember, we're now in the place where we have less than a year before Prove You're Working and Prove You're Exempt requirements are going to go into effect. And we are going to see additional funding lost for SNAP starting October 1st when the federal government pays less in for administration. So, what seemed like a long time away in July is rapidly looking like we don't have enough time to do this. There are now some additional studies that are trying to assess the impact of HR 1, and this one is specific to cancer screenings and cancer treatments. This is coming from the Journal of American Medical Association that is saying, hey, when people lose their healthcare coverage, the routine screenings that they're supposed to get don't happen. And that means there are people who, where cancer it could have been detected, that where it won't be until much later. And that might have a real impact on, lifespan. The article, was said that there are lots of people who don't know they have cancer until there's a test that shows that there is an issue they were unaware of. And this didn't examine all different kinds of cancer. It kind of looks at the most common ones, the occurrences. So there's definitely, a broader impact here with, additional cancers other than the three that were studied here that might be missed. There was also a statement about, there's lots of people who have ongoing treatment, and if they lose their coverage during treatment, delays or inability to get back into Medicaid might have a pretty big impact on whether or not survival and overall condition of somebody's life. Also this year, this is coming from California, um, most states, including Wisconsin, I think all states, actually contract out the running of their Medicaid plans. People choose basically an insurer. And that insurer is actually has a contract with the state to kind of run the Medicaid insurance program. So companies like LA Care in this case, but also Centene and Anthem and Elevance, Molina, United Healthcare. These are all companies that may have contracts with states and maybe many states to be the insurer that's running the state's Medicaid plan for people. And as a Medicaid participant, you might be choosing, a certain MCO that's managing your care. That's what you're choosing here. So California's version of Medicaid is Medi-Cal, and LA Care is one of the companies that runs a Medi-Cal plan. It has 2.2 million people in their insurance plan, which is more than, it's a huge number of people. It's more than the Medicaid and Children's Health Insurance Program enrolls in 41 states. And that's only one of California's Medi-Cal plans and insurers. This CEO is being really clear that she is assessing, and insurance companies, what they do is actuarially look at and try and predict, costs and such. This is in their business model. She's saying, hey, HR 1 is going to mean that 650,000 enrollees are going to fall off their plan alone. That's 25% of LA Care's Medi-Cal plan folks. Certainly, there are other insurers who are running, have a contract with the state to run the Medi-Cal program, and it is likely that many of them will also experience fewer people being in their Medi-Cal plans. That's going to change the insurers' finances and their revenues. So we haven't talked about this for a while, but the Medicaid cuts, we kind of tend to think of them from the individual's experience, whether or not they have health care. But there's certainly a very big ripple effect, not only on the healthcare delivery system like hospitals, et cetera, but also on insurance plans, because there are an awful lot of jobs and there's an awful lot of work that is really supported by Medicaid, essentially. And California has already done some things to reduce its Medicaid spending. It's reimposed an asset limit. We have in Wisconsin and other states, that's a common strategy, is to, think about how much can somebody earn and how much can somebody have saved away as a way to try and make it so that only the lowest income people can enter the program. So assets are how much you can have put away. So they've already done that. And it is really clear that they're going to also have to do additional spending cuts because of HR 1 in the next budget cycles as well. Idaho is in its second round of cuts as well. We're now starting to see kind of the ramping up of all of the things that we were saying were concerns last year. So Idaho's governor, again, smaller state, different budget, but when you don't have the money, you don't have the money, right? Yes, they're looking at a $45 million Medicaid cut next fiscal year. They've already cut some amount of Medicaid dollars last year. So this is, again, a second round of cuts. And this time, half of the cuts that they're proposing are coming from optional services, specifically home and community-based services and dental coverage for adults. So you can see the reasoning behind the governor's logic about why these services. It's because they're optional under federal Medicaid law. So for folks who have been telling you, oh, it doesn't mean you, these cuts won't harm you, here's a very tangible example of, well, the optional services that people with disabilities rely on are the ones that are in fact being targeted because they are optional by the state and because they are higher cost items. Here's what the Idaho listed for removing services from Medicaid. And you can see that there are an awful lot of things on here that we in this state would assume people with disabilities would be, and older adults would be the primary users of. Home and community-based services, dental care, pharmacy benefits for adults, prosthetics, in-home nursing, audio, visual, hospice services, case management, physical occupational speech therapy. Like these are all things that lots of people with disabilities would use in who are on Medicaid here. And it really isn't clear if they mean removing services, as in we're no longer offering these at all under our Medicaid state plan, like we are going to stop doing these things, or if it means that the funding for these things would be deeply cut and there would be far fewer people who would get these services, or there would be, what people would get if they were able to use those services would be very different than what it is now. North Carolina is also in the same situation. Again, they have had, this is now a second round of cuts. They did not pass a budget this fall. And so a first round of Medicaid cuts, which was partially rolled back, was implemented in October. And we kind of covered what kind of damage happened in the 8 weeks between when certain Medicaid payments stopped and when they started again. But now North Carolina is briefing its state legislators about what is it going to cost to implement these prove you're working or exempt requirements in the next year. Millions more every quarter to pay for additional county staff, system upgrades, vendor contract, member outreach. And every state is going to be in this position. And they have to now implement it within a very tight timeline. It isn't just that these requirements go into effect next January. They have to tell people what's happening by September. So the actual window of time to accomplish the work is really short. And the federal government doesn't have to provide any guidance to states formally until this June. So states really are in a position where they have to start doing something now, even if they don't know what that something is and whether CMS will like it, what they choose to do now. For counties, this is especially important. County government, and we're a state in Wisconsin that does an awful lot through our counties. Counties are doing a lot of workload on benefit stuff. These extra costs are something that counties can't absorb. They don't have many options if the state doesn't provide the extra money. And you could see the choices. You either have to raise taxes, and in some of these counties, there isn't a tax base that can afford to pay a lot more, or delay projects that are expensive and maybe needed, or cutting services. Like there's no good magic option here to make up for the work. At the same time, North Carolina again is also needing to think about how to manage hundreds of millions of dollars in new costs for SNAP. And you can see that the article is saying, well, and if we can't do that, do we continue doing SNAP at all? Again, pointing out that the amount of money that states get from the federal government to administer the SNAP program decreases significantly as of October 1st. And you can see that in North Carolina, what that means is a pretty high 67 million state dollar or local dollars and 16 million state dollars would be needed to kind of make up for that lost administrative support from the federal government. Lots of people rely on SNAP in North Carolina and in all states. And it is especially important, again, not only to individuals and families, but to the grocery stores who are trying to serve people. And this is a revenue source that they have to keep their businesses alive. In the article, it's important to note that there are lawmakers that don't see people losing their benefits as being a problem necessarily. That the idea that you need more money to do more work to serve the same amount of people or to help people who now have to do more things as not being a particularly important investment, because if those people lose benefits, then the workload goes down. That is something that folks are hearing in state legislative chambers, and perhaps that's something to be listening for as you speak with your lawmakers as well. And then the last thing, we've talked a little bit about the rural health transformation plans. I think the important thing here is to know is that what CMS awarded states this round is not necessarily what they will get every round. And that again, the state has a relatively short amount of time, 8 months, to submit budgets, begin spending, show how the money is going to be used. And they may or not get any cash to do it until March, because there are a series of review periods that can take a set amount of time to happen. So by late summer, CMS is going to, take what states have provided and then redecide how much money states get into 2027 by October. And lots of watchers are expecting that what states got awarded this time around may be very different, and it may be that different places get more or less money next year and for the next 4 years. So this should not be seen as necessarily a constant, stable, steady amount of funding. It's rather something where we know what happened this year, and now we have uncertainty for the next 4 years before the money runs out. And I'm going to stop sharing.
No questions this morning.